Just a little bit of recap. When you look here at this image that I have, so these are what we call the internal organs of the reproductive system. You can see down here, this is the vagina, and in continuation with the vagina is what we call the uterus. And from the uterus, we have tubes which, as you can see, are beautifully hugging the ovaries here. Okay, and this is what we consider the internal. This is what you will not see normally as a lady when you look at yourself on the mirror. The modern family, once again, we are here. Karibuni sana. My name is Dr. Tetty. My clinic is located at Modern Gyno Clinic, which is on Jubilee Building, first floor. Once you just come in, even if you cannot be able to locate the clinic, you should be assisted by the guards at the entrance who should be able to direct you to where our clinic is. Our numbers, our social pages are all located in this broadcast, and so you can also reach us through this. I am an obstetrician, gynecologist. I am also a laparoscopic surgeon, and on top of that, I specialize in female reproductive cancers. And so we've been doing a series of shoots mainly on cancer, and today it is my pleasure and I feel honored to be able to introduce you to another topic about cancer. And today we are going to discuss cancer of the vulva. Okay, and don't worry about what the vulva is, because we are going to go deeper into this. What is the vulva? I know it sounds, it's a term that is not commonly used. When you look at all the other things that we've been discussing, whether it is the cervix, the ovary, the uterus, we all have a rough idea. What is that? Now, when we look at the vulva, again, I will go back to what we've always done. Just a little bit of recap. When you look here at this image that I have, so these are what we call the internal organs of the reproductive system. You can see down here, this is the vagina, and in continuation with the vagina is what we call the uterus. And from the uterus, we have tubes which, as you can see, are beautifully hugging the ovaries here. Okay, and this is what we consider the internal. This is what you will not see normally as a lady when you look at yourself on the mirror. However, on the outer part, okay, of your reproductive system, this is what we call the vulva, and this is just a schematic presentation of that. But now, what you see, in case you are able to go in front of a mirror, this is what you're going to see. And this picture that we have here is what we term as the vulva. So starting from where there is usually the pubic hair, okay, what sometimes as gynecologists we call the heel of love, mlima wa mapenzi, okay, starting from there, and then you come on the sides of the vagina, including all these structures that you're seeing here. This is the clitoris, okay, the entrance of the vagina. This is the urethral opening where we pass the urine from. That is the vagina, and including this area just above the anal area. So all this area is what we call the vulva. And there are many cancers that can arise here. Luckily for us, okay, in our setting, these cancers account for only 5% of all the female cancers that we usually come across, and it is the fourth commonest gynecological cancer. This is after the cancer of the cervix, after the cancer of the ovary, after the cancer of the uterus, and the fourth one is actually cancer of the vulva. There are very many types of cancers that can arise from the vulva. Remember, there is skin there, and you can get cancers from the skin. Things like melanoma, okay, I don't want you to go into the names. Things like basal cell carcinoma, these ones arise from the skin. Then there are other things, okay, you have glands there, and all this can be able to give you some form of cancer. However, the commonest cancer in all those ones is what we call squamous cell carcinoma of the vulva. Again, these are just scientific names, you do not need to go into them. So the other question that kept on popping is, what are the signs, and probably how would I know that I have vulval cancer? So the beauty about this type of cancer, unlike all the cancers that we've been seeing, whereby you cannot be able to directly see it, because this is located on the outer part of your body, this is what you will see. So it is very easy to pick a cancer that is developing around here, even by you as the client, as compared to the rest of the other cancers. So some of the things that you can see are things like itchiness. Okay, so you have this itch that does not go away. I don't want you to leave here saying that, oh, now I'm itching, I have cancer, but this can be one of the signs. You can have something swelling there, okay, around any of those places. You can have a wound, okay, there that is probably not healing, okay. Commonly we call them ulcers, so this is another sign that you can also have. You can have peeling off of the skin, okay, or the area around there. You can have change in skin color, okay, and you can also have swellings at the where your legs just join the upper part of your body. We call it the groin, okay. You can also have swellings there, so this can also be a sign of vulval cancer. And of course, like any other cancer, usually it can spread, and if it spreads, let's say to the lung, if it spreads to the liver, if it spreads to the brain, all those can give you signs of a spreading cancer. The other question is, what are the causes of vulval cancer? There are usually two types of vulval cancer when we look at them in terms of what causes them. There is vulval cancer that is caused by what we call HPV infection, the same HPV that causes cervical cancer. Okay, cancer of the cervix is actually one of the main offending organisms when it comes to cancer of the vulva. And this is usually common in younger patients, okay, patients who are still sexually active. And the good thing with these ones is that the outcome as compared to the other type of cancer that I'm going to talk about is usually better, okay. And now the other type of cancer, the other cause of cancer is what we call chronic inflammation, or rather chronic irritation of the vulva. And this chronic irritation or chronic inflammation of the vulva can come because of many things, okay. Number one, it can be because of some skin conditions, okay. I don't want to go into the names, but for those of you who are interested, if you have a skin condition like lichen planus, okay, lichen simplex, all those ones can actually put you at a risk of getting vulval cancer. Another cause can be radiation therapy. When we are radiating another part of the body, ile kuchomwa ya cancer, okay, sometimes some people have been shown to develop other cancers at other places, and vulva can be one of those places. And there are many other things, like if you are given some form of chemotherapy, also can give you that. If you are exposed to some things, okay, in the uterus, as when you're developing, also there is a risk of that. I don't want to go into those very tactical explanations. Another thing is, how long does it take, okay, to develop for cancer for the process of cancer to start until when it becomes fully blown cancer. As I have explained, there are two ways in which you get vulval cancer. The first one is by HPV infection, and the second pathway is by chronic inflammation. As you can see, this will take some time, okay, from the time you get infected with HPV, okay, to the time you develop cancer, it actually goes into stages, okay. And it is the same thing with those skin conditions, chronic inflammations that I've talked about. From the time you start having that condition until now it turns into cancer, it is quite a duration. Really, to put a timeline to it might not be fair, but what people have said, from the time you get infection to the time probably it develops to cancer can take anywhere, okay, up to even 30 years. So it's usually a process, and this is a good thing for us and for the patients, because what it means is that we have a window of which we can be able to pick this kind of process before it progresses to cancer. How do we then prevent getting this vulval cancer? We usually divide prevention into primary, okay, meaning the first thing that you do before even the process starts and secondary, which means things that you can do, okay, even if the process has started. So one of the things we are advocating, remember we have said the commonest cause of vulval cancer is HPV infection, human papilloma virus infection. Currently we have very effective vaccines, okay, which we are able to give to girls who are not sexually active, who have not been exposed to HPV between 9 to 14 years. And so this is the main thing. Apart from just protecting you from the cancer of the cervix, it will protect you from cancer of the vagina, cancer of the vulva, cancer of the throat. There are some cancers of the throat also which are caused by HPV, and even cancer of the anal area, the area where we usually pass stool from, or rather we pass feces from. So all those come with the benefit of prevention when you have a HPV immunization. In case you did not have HPV, then there are some HPV immunization, then there are some things that you can actually do to help you prevent this. And because we've said one of the things is HPV infection, which is sexually transmitted most of the times, or more than 95% of the times, then it means having healthy sexual behavior is one of the ways that you can actually protect you from getting HPV infection and so getting vulval cancer. So it means using of condoms, it means probably any other sexually transmitted infection that you get has to be treated, okay, in time. So all these are things that you can do to actually help you prevent vulval cancer. The other thing that we have been saying all through is that you need to be a friend to your gynecologist. So every year you have to pass by your gynecologist's office, and one of the things that we do is just to look at that area, okay? And once, as I have said, the good thing with vulval cancer is any gynecologist will be able to pick it just by looking, even without doing anything else. The other thing that we can do, there is a machine that we use which helps us magnify, okay, the cells of the vulval area, what we call colposcopy, and this would actually direct us to an area that there is an abnormality, and there we can usually take a piece, or rather part of that the vulva, and we take it to the pathologist and be able to analyze it and tell you if probably there is a risk factor or not. So all this are things that we can do to prevent. So let us remember lifestyle changes, of course, alcohol and smoking. Let us remember healthy sexual behavior. And number 3, let us remember to be able to visit our gynecologist every year. How does it spread? Just like any other cancers, the commonest way of spread of this cancer of the vulva is usually by direct spread. So you will find sometimes if the cancer is here, okay, it can spread to anything that is next to it. So it can go to the anus area, okay, it can move from there, it can go into the vagina, and it can spread all around that area. The other ways that it can spread is by lymphatics, okay. Remember, there is a system in the body which we call the lymphatic system. It runs the same way as the blood system, but is a different one. This has also been shown to cause spread. And then the other spread that can happen is through bloodstream, and this is why you get, although you have cancer of the vulva down there at the pelvis, then you find some people actually having even cancer cells on the neck, on the chest, and the liver. Those ones mainly are because of blood spread. What are our treatment options? Okay, the best treatment options for vulval cancer is actually surgery, okay, and we usually fashion that surgery depending on how the cancer is, okay. Things like the size of the cancer, how deep is it on one side only, or is it at the middle part? So then we usually fashion and we design on how we are going to cut it out. The most important thing is that when we are cutting it out, we must cut it with some normal tissue, which should be at least 1 centimeters on the normal tissues. And we have ways of repairing this, okay, after we do that. And the vulva heals very well that it goes back. Even after those surgeries, it heals so well that it goes back to the way it was. And this has been evidence for those women who probably have given birth na mkaongezwa njia, unaonanga pale where tunaenda kushona, tukishashona, okay, it heals very well and people might not even know that surgery was done. So this is the same thing, because the tissues around there tend to heal very well. The other thing that we can do in combination with surgery or even standalone is what we call kuchomwa, okay, what we call radiotherapy is something that is very effective when it comes to vulval cancer, okay, and this we can do. And the other thing we can do is there are drugs that we can also give, what we commonly call chemotherapy. Which one starts and which one comes after what, okay, it depends, okay. For example, if we realize your cancer has spread a little bit but it is just around the lower area, okay, we can start with radiotherapy, okay, because we've seen that if we try to cut it, we might cause you not to be able to pass stool very well or not to be able to have urine continence. So what we do is, with those kind of patients, then we will tend to start with radiotherapy, shrink the cancer a little bit, then come in later and do surgery. So which one comes first depends. Something like chemotherapy, if you have cancer that has spread from the pelvis area and now it is on the liver or it is in the chest, then the best treatment that we will start with is actually chemotherapy. So you tend to play with them, okay, depending on how the patient has presented to you and the stage of the disease. The other question is, now I have vulval cancer. What will determine how long will I live and how long will I live, okay? So there are different things that actually guide and dictate what we call in medical term prognosis, meaning survival and the outcome of that disease. So one of them is how big is the cancer. So if the size of that cancer that we are seeing is more than 2 centimeters, then it starts pointing towards, it reduces your chances. The other thing that we look at is how deep has the cancer gone in terms of depth of the cancer into the tissues. The other thing is the type of the cancer. For example, if you had a cancer like melanoma, okay, the outcome is very bad as compared to a cancer like basal cell carcinoma, which all of them can occur within what? Within the vulva. The other thing that will determine the outcome of your treatment is, did we manage to get normal tissue plus the cancer? What I've said, 1 centimeters wide, okay, of normal tissue. This will also help determine that. Another thing is where the spread is, okay. So if the lymph nodes are involved, if the lungs are involved, if the liver is involved, some of them have the cancer even spreading to the brain, then that one tends to reduce your outcomes. Then there are patients who probably you treated, they were declared probably as healed, and then the cancer comes back after maybe 1 year or after 2 years. So if you've also had prior treatment and then the cancer tends to come back, then this one also usually reduces your outcome. However, roughly, if the cancer is at stage 1, okay, you have 95% chances of being alive within 5 years, okay. If the cancer is at stage 2, then we look at about 75%. Stage 3 and stage 4, then you are looking at 50% and 25% chances of being alive within 5 years. So that is how roughly that goes. But those are the determinants that I have managed to talk about. And then, because we are obstetricians, gynecologists, and this is why we are here, the big question is, what about my sexual activity? I mean, if you look at this vulva, okay, there is no sexual activity that can take place here, okay, unless this area is intact. And we are telling you, this is the area that we are going to cut. This is the area that we are going to radiate with radiation, okay, and we are going to cut and try to repair it. What about my sexual life after that? We are here to tell you that that is a myth, okay? Once we do that, there are things that we usually do. As I've told you, one of the goals of deciding on which treatment we are going to do is considering your sexual life and your age. We are lucky that most of these cancers, we see them in older women, okay? But we are not saying that older women are not sexually active. However, if then that is the worry, then we have some things that we usually do to make sure that the sexual activity actually continues uninterrupted even after treatment. One of them is we have what we call vaginal dilators, which we can use, okay? And these dilators can be, yes, you can buy them, but if you cannot buy them, even using your fingers just to dilate that area after treatment so that it does not become, for lack of a better word, it does not become too small for penetration. That is one of the things that we use. The other trick that we use is that we, most of the time, if we have very large cancers, we usually involve plastic surgeons who are able to refashion using different muscles and using different techniques. They are even able to recreate the whole place, okay? So depending on the extent, sometimes we might go into theater with the plastic surgeon. The other things we can use, there is nothing wrong with using lubricants, because sometimes we found after those surgeries there is reduced lubrication to the patients, and of course if there is reduced lubrication, then penetration will be painful and it will be difficult. Other things that we can do, we can give you estrogen patches or estrogen cream, what we commonly call Primarin, okay? And this can also be able to help. However, if all these things fail, we all know life is very, very important. Yes, the quality of life reduces with sexual activity, but there are other sexual activities that people can be involved in case penetration is not possible. This is in rare occasions. So I know of couples, okay, who have actually used their breasts, okay, and as part of the sexual activity. So you actually put your penis in between the breast, and your partner should be able to get some form of satisfaction, and all those other things that people can use, okay, as an alternative to penetrative sex. But this is in those very, very extreme cases. The other thing why we study obstetrics gynecology is actually to bring the babies to the world. And the other question is, now you are removing where the sperm is supposed to go through. What happens to my fertility after that? Okay, as I've said, luckily again for this, most of them are within older patients who probably have finished their fertility careers, okay? What you need to know is fertility of in vulval cancer is not altered, okay, by the surgery that we do. So surgery does not alter fertility. Sexual activity, that is different, but in terms of fertility, we do not alter. However, some of the treatments that we actually give can alter fertility. For example, radiotherapy. In case you radiate the ovaries a lot, okay, you might actually cause ovarian failure, and this can lead to infertility. The other thing is the chemotherapy. There are some form of chemotherapies that when we give, okay, usually can also reduce your fertility. But the good thing with chemotherapy, unlike radiotherapy, immediately we stop the chemotherapy, within a few months your ovaries actually start functioning again. The other thing that might actually not play a very big role, or rather play a big role depending on how you look at it, once we have done the surgery there, most of our patients, sorry to say, have psychological issues, and so the frequency of sexual activity might not be as the way it used to be before, and this also tends to affect fertility of patients. But lucky to us, in case you have such kind of a thing, then you should come in and we should organize a session, a sit down with your gynecologist, okay, your cancer specialist, and probably a psychologist to help deal with those kind of things. Now, having said all that, what we are saying is, if you remember what I've said as the symptoms of cancer: itchiness, change of skin color, wounds, okay, around that area, all those things are very common. And so we are not now saying that from here, whenever you see wound, whenever you see itchiness, whenever you see discharge, you have cancer. No, because there are other many things that can actually give you this thing, and cancer is lower on the list. As much as we are saying it is rare, you need to come in case you have any of those symptoms that I've talked about. Then the gynecologist would examine you and decide if there is need to take this to go and take it to the pathologist or not. So some of those other conditions include things like warts, okay? Warts are very common. They are caused by HPV, but low risk HPV. You have things like fibroids. You can actually have fibroids that develop within the vulva, okay? They are not just restricted to the uterus. You have other skin conditions. There are people with vitiligo, okay, what we call vitiligo, the discoloring of the skin, okay. This can just be vitiligo and not cancer. Don't start thinking in those lines, but again, you need to come in and we should be the ones to make that decision. There are some infections that can actually present with very big wounds, okay, around that area, which might just need antibiotics, antifungals, okay, for treatment to take place. There are things like Bartholin's abscess and Bartholin's cyst. There is a gland there, okay, which is very controversial. Some people say it is the one responsible for squatting. Others say squatting does not exist. That is for other people, okay. But that gland sometimes can swell also and become very painful. Have ooza in it, what we call pus, or sometimes it can just form a cyst. So there are other many things that can appear on the vulva. Although they present the same way as cancer of the vulva, it is important for you to come in and we have a check. Once again, as I've always said, make your gynecologist your friend. We are here, Modern Gyno Clinic, okay, first floor, Jubilee Building. Dr. Tetty, we will be waiting for you. Asante sana.